Fully vaccinated people do have the potential to be able to transmit COVID-19 to others. This appears to be reduced with vaccination, but it's not reduced enough to allow for unmasking in all situations. Because of this potential, that's why people in areas of high transmission are still asked to mask. This is also why people who are in areas where there are especially vulnerable patients, or people like in hospital settings where we take care of patients who may have weaker immune systems, are still recommended to wear masks to protect those who are at the highest risk of transmission, even from vaccinated people. We know that some people who are vaccinated do have the ability to have high levels of virus in their nose and in their throat, even if they don't have symptoms. This isn't a surprise. Many different types of vaccines prevent illness, but don't necessarily prevent you from being able to transmit that illness to others. What I say to people who are concerned that they can still get infected by the Delta variant, even though they're vaccinated, is your illness, if you do get infected, is going to be far, far less severe than if you don't get vaccinated. Most people who get the vaccine aren't going to get infected. Of those who do get infected, it takes what can be a deadly illness down to something you may not even aware of, or even a bad cold at the worst. Unless you have some of these immune compromising conditions where the vaccine doesn't really take and you're in one of those vulnerable groups, your risk of having a severe infection that lands you in the hospital or puts you in mortal danger is far, far lower when you get vaccinated. Widespread vaccination is still our road back to normal. If enough people are vaccinated, we will reduce transmission of the virus. We know that even though it's not perfect at reducing transmission, it drastically reduces it. It reduces your risk of being hospitalized or having severe illness even more. And if enough people are vaccinated, the risk of things like having overwhelmed hospitals or large numbers of very sick individuals goes down, and we can start to get back to normal.